In addition to traditional beneficiaries, NCEF looked to proactively engage in strategic partnerships with local nonprofits, local colleges, universities, and other foundations with the goal of creating long-term solutions to fill the gaps.
The blueprint partners included within the NCEF strategic initiatives exemplify the highest levels of efficacy and accountability. Blueprint partners collaborate to optimize funding and develop innovative strategies to deliver high-quality programs and services. First, Children's Early Learning Initiative, $2,555,000. In rural and low-income communities, families struggle to afford and access high-quality early learning programs. When 46% of these children live in non-English households where English is rarely spoken, they fail to learn the basic English knowledge and skills required to enter school ready to learn, growing the achievement gap between children exponentially. The only way to dramatically decrease achievement gaps is to provide rich learning experiences much sooner than standard school-aged entry, especially for those living in disadvantaged environments. Immokalee has one of the highest concentrations of child poverty in Collier County. Due to this, NCEF established family child care homes within Immokalee that act as feeder homes to 3 major child care centers: Guadalupe Center, Pathways Early Education Center of Immokalee, and Redlands Christian Migrant Association, or RCMA.
The Early Learning Initiative is enhanced with the incorporation of supplemental services like the Specialized Therapeutic Analysis Resources Initiative. It provides behavioral analysis for children birth to age 5 who may be at risk and require behavior intervention. Additional services are provided through the Early Literacy and Learning Model, or ELM, which creates a cohesive network of early learning sites while providing professional development, curriculum, assessments, and classroom materials. As teachers increase their knowledge, skills, and self-confidence, student outcomes improve. Through the educational foundation provided by high-quality childcare and teaching, the Early Learning Initiative has helped to bridge the school readiness gap created by poverty. Since its inception, the Early Learning Initiative has educated more than 53,000 children through high-quality early childhood education programs, increasing the number of children served by early learning programs by 20%. And now to the Children's Hunger Initiative $100,000. Hunger hurts everyone, but it is especially devastating for children because it deprives them of more than just food.
On empty stomachs, kids do not have the energy to focus, engage, learn, and grow. For the over 60% of students who are eligible for free or reduced lunch at Collier County Public Schools, the 2 meals they receive at school represent their entire diet. Affectionately called Lunch Boxes of Love, the Hunger Initiative provides nutritious food to children and their families that struggle with food insecurity. Mobile food distribution to underserved communities is only one part of a deliberate and strategic plan. Other aspects of this initiative include strategies such as nutrition education, distributions of fresh fruits and vegetables, school-based food pantries, and increasing the capacity of current food distribution sites with plans of retrofitting current space to allow for perishable food storage, all with the goal to eliminate barriers for children with food insecurity. Since its inception, the Hunger Initiative has provided over 11 million meals to children and families in the community, all through mobile pantries, in school pantries, and meal packing events, decreasing the number of hungry children in Collier County by 24%. Next, Children's Mental Health Initiative, $3,176,309. 6 separate NCEF Commission studies have documented the daunting challenges of mental health care in our community.
Compared to last year, the lack of prevention services, such as early identification through routine screening and early intervention, has led to a 37% increase in the number of times a Baker Act, meaning they were involuntarily committed due to a possible mental illness or in danger of becoming a harm to oneself or others, was used on a child in Collier County. Through the mental health initiative named Beautiful Minds, NCEF has brought together key providers in the community to shift the provision of mental health services to an integrated primary care model to identify mental illness at a much earlier stage and promptly initiate evaluation and treatment. The initiative's education component helps families learn the signs of mental illness and how to ask for help.
Through the initiative, early identification, expert diagnosis, and effective individual treatment are provided, along with taking away the stigma and empowering children with help and answers. Since its inception, more than 67,000 youth have received effective and coordinated mental health services and treatment, all through Beautiful Minds. Each year, this integrated approach allows over 3,000 children to receive mental health screenings during their pediatric well visits, leading to early diagnosis and treatment. Children's Oral Health Initiative, $2,091,000. A main challenge faced with children's oral health in Collier County is the lack of access to care.
According to the Health Resources and Services Administration, or HRSA, Collier County is a federally designated dental health underserved area, causing limited access to primary care. Children receiving only minimal or zero oral care, like the 20% of Collier County Public School students who needed urgent care due to mouth pain and infection in 2020, have the possibility of severe medical complications becoming dangerous or even fatal. NCEF spearheaded the Oral Health Initiative with unique public-private partnerships used to build and maintain the NCEF Pediatric Dental Center in 2008. Going beyond the center, the first oral health surveillance system was developed in 2013, increasing preventative services with the school-based dental sealant program. In addition, UF dental hygienists conduct oral health screenings for all third grade students. Since its inception, there have been approximately 165,978 visits to the Pediatric Dental Center in conjunction with a mobile sealant program, increasing the number of third grade students with dental sealants on their permanent molars by 77%.
Children's Out of School Time Initiative, $1,996,000. The Immokalee student demographic profiles show 97% qualifying as being economically needy, 85% coming from non-English speaking homes, and 27% having limited English proficiency. When these children do not have the option to participate in high-quality out-of-school time programs, they lose access to critical pathways for long-term academic success, making graduation and matriculation into college or post-secondary training an almost insurmountable challenge. To address this significant gap within Immokalee, NCEF brought together key out-of-school time providers to collaborate, leveraging resources, expanding capacity, providing academic safety nets, and offering enriching opportunities within a safe, nurturing environment. Since its inception, the Out of School Time Initiative has impacted over 40,921 at-risk children in Immokalee, improving Immokalee High School's graduation rate by 24.9 percentage points, reaching a record high of 89.6%. And finally, Children's Vision Initiative, $1,790,771.62. Vision problems are one of the most prevalent and handicapping conditions in childhood.
Low income and minority children are at a greater risk of underdiagnosis and undertreatment of vision problems, as well as unmet needs for vision care. Among students at Collier County Public Title I schools, which are schools with high numbers or high percentages of children who are disadvantaged, 85% have vision problems that are either undetected or untreated. The earlier students are identified and treated for vision problems, the better the academic outcomes. Through NCEF's Vision Initiative, children receive quality eye care, glasses, and treatment, providing the tools they need for academic and social success. The initiative makes a lasting impact by allowing students to see well in school and for the rest of their lives.
Since its inception, the Vision Initiative, dubbed Now You See It, has provided 153,717 vision screenings and provided 38,728 pairs of glasses to children, improving 94% of recipients' grades in 2 or more subjects. NCEF is truly making the difference in the lives of children in Collier County. I'm Lindsay Sablon.
And I'm Corey Lazar.